Hi, Dr. John with Pro Chiropractic, and we're here demonstrating Graston technique again, and today we're going to talk about the forearm, and specifically the treatment that I like to do for tennis elbow. Tennis elbow is also called lateral epicondylosis, so let's demonstrate how we would use the Graston technique. We always want to apply some emollient on the area. That reduces the friction on the skin surface, makes it more slippery so we're not starting a fire with the instruments. First of all, what I want to do is scan through the forearm, and what we're looking for here is areas that feel smooth and also areas that feel gritty or more restricted in there as we do the Graston technique. And right away you're going to notice the areas that are more gritty or have more restriction, we're going to get a reddening of the skin. Sometimes we even get a little breaking of the blood vessel underneath, and we call that petechia. That's all normal with the Graston technique. We don't have to have it for the treatment to be very effective. And in fact, some practitioners go too deep if they're not skilled at this. I've seen some practitioners use gua sha instruments and go way too much for the area. But we're scanning through the extensor muscle group of the forearm here and working through the areas that are gritty and restricted. Haley, what do you feel while we're doing this?
It's not painful, so it just, I don't know, feels like Indian burn. No, I'm just kidding, not at all.
Okay.
It's not, it just feels like rubbing.
Okay, gotcha. And she can probably perceive that some areas feel smooth, like this over here, and some feel more gritty or gravel.
Yeah.
I like to call it the gritty gravel road sensation.
Mm-hmm.
So I'm working my way up, releasing the adhesions in the superficial level of the fascia, right into where these muscles insert. Now there's an area right here called the lateral epicondyle. It's the area where the extensor muscles of the forearm come up and anchor to the bone. So if we were to have Haley extend her wrist back and I was to put some pressure against it, you would see those muscles come out and be more prominent, and you would see where that attachment point is. Go ahead and relax back down. If I was to just poke my thumb in there and she had tennis elbow, that would be a very, very tender thing. And most of the time, even when you don't have a problem where those muscles attached to the bone, it's going to be more tender in there. So then I would use a more focused instrument as we got closer, because it really identifies the area that has the most adhesion. And if you could feel what I feel resonating through the instrument, you would feel that this area is quite a bit grittier and more restricted than some of the other areas we work on right here. And so I would focus some very focused strokes right in this area, working through that, freeing up the adhesions. Now on a very acute case, we might be done for the first treatment. Graston technique usually doesn't take more than 10 minutes, and it might even be as little as 3 or 4 minutes to be very, very effective. Graston technique, in my opinion, on the same body area shouldn't be done more than twice a week, okay? And it shouldn't be done more than a dozen times. You should get the effectiveness in that period of time. Now, I also think that it shouldn't be done less than twice a week if you're gaining the right kind of effectiveness. It's kind of like anything with the body. If you overwork an area, you're going to create injury. And if you stimulate healing just right in the right amount of time, you're going to have the good results. Now this instrument, the GT3, can get very focused, and so we can get right in against that. I'll give April a little bit of room here. Right against that lateral epicondyle, and that can be very tender, but we can focus right into that area very specifically to release where the adhesions are in there. And so this we might not do on the first visit every time, but we can get very focused using this instrument right into where those attach. So again, Graston technique using some of the different instruments. Let me demonstrate one more that I like to use, especially around an elbow or a forearm. This instrument here has two different treatment edges. One is smooth and one is a little bit more aggressive. And so we can frame right around that elbow, right around the forearm. Now there are some areas you have to be careful about where nerves cross in here. So Graston technique should not be done unless you're a qualified professional. Do not use butter and a butter knife at home like one of my patients did at one point. But get a licensed, skilled Graston practitioner. You can go to grastontechnique.com and Google and find somebody in your area. If you'd like to learn more about Graston technique, click below this video. We have some links to other body areas, other treatments. You can log on to our website at prochiromt.com for a free report on Graston technique, or shoot me an email. I'm Dr. John at Pro Chiropractic Sports Medicine Specialist in Bozeman, Montana. Thanks.